Hi, welcome back to IU Radiology Case of the Day. My name is Tim. I'd like to take a moment to emphasize that all the content in this presentation has been fully de-identified to protect patient privacy. For the history on this case, we have a 35-year-old patient with left knee pain. Here are the images for the case. We have axial, sagittal, and coronal T2 fat-saturated images. Alright, now what are our findings and what is our diagnosis? Let's go through the images. We see that there is increased T2 signal and thickness of the quadriceps fat pad. This can sometimes be tricky with inhomogeneous fat signal suppression as in the far anterior and posterior aspects of the knee on this image. Trainees should make note that the uninvolved subcutaneous fat at the level of the quadriceps fat pad that suppresses just fine, so this edema is indeed real. We can see this again on the coronal and sagittal images. The posterior border of the quadriceps fat pad is also notably convex. Here we have a case of quadriceps fat pad impingement. This can be a cause of anterior knee pain, although the entity is a tad controversial. This is thought to be analogous to Hoffa's disease, with edema involving the infrapatellar fat pad instead. The pathogenesis is not clearly understood, but it may be reflective of abnormal mechanics or developmental anatomy of the extensor mechanism. It may also be involved during high-angle knee flexion, as it will then articulate with the femoral trochlea. Histologic evaluation in one patient by Dr. Shabshin and colleagues revealed vasculitis and an inflammatory response of the quadriceps fat pad similar to Hoffa's disease. In any case, findings of quadriceps fat pad impingement include edema with high T2 signal and a posteriorly convex border of the fat pad. For more reading on other impingement syndromes and other disorders of the knee, I'd like to recommend this article. So to sum it all up, quadriceps fat pad impingement can be a cause of anterior knee pain and can be seen with T2 hyperintensity and edema of the fat pad, which causes bulging and convexity of the posterior fat pad border. It's a bit controversial, but when the patient is experiencing knee pain in the absence of other findings, I'd be hard-pressed to not make the call. So as always, thanks for tuning in to IU Radiology Case of the Day. You can follow along on Twitter at NACoons, and you can check out our complete collection of Case of the Day materials at the website below. Thanks so much and have a great day. And I'm a fourth-year resident at the Indiana University School of Medicine. Today, we've got an interesting musculoskeletal case. I'd like to give a shout out and thanks to Dr. Roth for his help, and of course, Dr. Coons for organizing the entire Case of the Day initiative.